One of the commonest complications of diabetes is diabetes neuropathy. And diabetes neuropathy is associated with limb amputation. And the leg of diabetes patient every 30 seconds is being amputated. But do not be afraid. It's not every diabetic patient that experiences this risk of amputation. If you make sure that your blood sugar is good and you take care of your feet, there's no risk of amputation. So today I'm going to discuss the measures that you take to protect your feet. One of the most important measures is ensure your blood sugar is always good, ensure your BP is good, correct cholesterol abnormalities, and please do not smoke. But it is also important that you care for the feet itself. You should never walk barefooted. Always inspect your feet every single day. And if you cannot do it yourself, please ask someone to check your feet for you, checking for any ulcer, any wound, any laceration or any swelling. Also, when you're cutting your nails, please do not use razor blade. You can use nail cutter, and please don't cut too deep that you may injure yourself, because anytime you injure yourself, there's risk of infection coming into your feet and also leading to complications. But today I want to talk about an important aspect of the care of the feet. One of the most important aspects of care of the feet is the kind of shoe you wear. It is very, very important. So what is the appropriate or the best shoe for a diabetic patient to use? First of all, the outer sole should be flexible and also should be stiff or thick. The reason why it should be flexible and light so that diabetic patient can be able to walk, because if it is too heavy, it may limit the movement of diabetic patient. You know, some diabetic patients don't even feel their leg. Their legs are heavy. So if you put heavy shoe, you're complicating the matter. And it should be thick and stiff so that even if they match a nail or a thorn or whatsoever, it cannot penetrate the leg and cause them injury. So number one. Number two, the inner sole where their feet is on should be smooth. It should be smooth, it should be soft so that they cannot develop blisters. You know, when they develop blisters, it can rupture and form a wound. Very, very important. It is also very important that the toes should be within the shoe. It should not be outside the shoe, because if the toe is always outside the shoe, there is risk that the toe can easily get some injury, and that's how the infection will start and cause other complications. It is very important that the shoe you're wearing, whether it's slippers or half shoe or whatsoever, it does not have a neck or nose or whatsoever you like to call it, because in between the big toe and the next toe, there will be some injury that will lead to infection. So do not have that neck or nose, as the case may be. It is very important that any shoe that a diabetic patient is wearing should have adjustment. You should be able to adjust it depending on how you feel. It should not be tied. Once it's tied, there is a problem, because blood supply to the leg will be compromised, and it should not be too oversized, because you are at risk of falling down, and when a diabetic patient falls down, he can develop some injury. This is an example of how a diabetic shoe should be. If you look at it critically, it has a thick outer sole which prevents injury. It has a high and wide toe box to ensure that the toe does not go out of the feet. You can see that it has a Velcro. Velcro is an adjuster to ensure that whenever you feel like a bit tight, you can adjust it. You can see it also has a tough heel counter here. Tough heel counter is to prevent the heel from getting injury. And you can see that the inner sole is well padded to ensure that you do not develop blisters. So this is the kind of shoe that a diabetic patient should be wearing, so that you make sure you do not have risks of complication, especially diabetic patients that have started developing this neuropathy, like tingling and burning sensation on the feet, like numbness, or sometimes you don't feel anything on your feet. You need this kind of a shoe. So there are different varieties of the shoe that diabetes patients should use. So please, diabetes patients should not use this kind of slippers. Why? One, it has the neck or the nose, which can cause injury in between the toes. The sole is soft, so anything that the diabetic patient march upon can easily penetrate. So this is out of line. Then heels, a diabetic patient cannot wear heels or any kind of shoe that is tied. This is very, very important. So if you are one of these diabetic patients that is having challenges with his feet, there are a lot of companies that can construct your customized shoe using this criteria. So show those people and they will help you construct the shoe that is best for you. But always take care of your feet. You are going to reduce the risk of amputation to the barest minimum. I hope you understand.